People ask me, after how many days of my spine surgery, doctor, I will start walking? Hi and welcome. My name is Dr. Devashish. I am a spine surgeon, and today I have a very important question, very common question which people ask me during my OPD consultations, be it an online digital consult, be it a physical consult. People ask me, after how many days of my spine surgery, doctor, I will start walking? How many days or months of bed rest I have to do? A very serious question, because that involves a lot of questions which revolve around the patient and the kind of domestic help patient would require after patient would have gone through the surgery. Well, I just want to tell you that in my practice, the kind of spine surgeries we do, provided my patient is walking pre-operatively, is able to walk somehow, 99.99% of my patients would walk after surgery just few hours later. So if you have an endoscopic spine surgery and you were not paralyzed before surgery, there is a high possibility that you'll start walking 2 hours after spine surgery or endoscopic spine surgery, or maximally next day morning after the spine surgery. In a standard TLIF surgery, which I generally perform with a microscope and an endoscope, my patients start walking 6 to 8 hours post-surgery or next day morning sometimes, whichever is earlier. And these surgeries are pretty much common. A regular cervical discectomy, a regular ACDF. Most of the surgeries, in my practice, 99% of the surgeries, my patient starts walking next day after the surgery. There are exception of 1% of the cases. Now, what are those 1%? 1% of the patients are the ones which have already come paralyzed. They were already on wheelchair. They already lost all the power before they could find us, or before they could decide that they finally needed surgery. They were already totally paralyzed. These patients requires long-term rehabilitation and physiotherapy in order to gain power. But if you're walking before surgery, high possibility that you'll walk after surgery with no pain, with very good results. So all the spine surgeries nowadays, including endoscopic spine surgery and microscopic spine surgeries, and in some cases open spine surgeries, give very, very good results. And I'm personally a fan of endoscopic spine surgery. And this surgery is almost 100% painless. My patient starts walking in post few hours. There is no blood loss. There are no stitches. There is no risk involved. And when I say no risk, 99.99%, the visualization is so good that there is no way you can chop off the nerve, and my patient is awake. So he serves as a live monitor. So there is a high chance that there is no injury to the nerve happening when the patient is awake. And in interlaminar surgeries, some of the times patient is already kept awake, and even when the patient sleeps, the visualization helps us so much that the chance of nerve injuries really become very, very low. So that is why most of my patients start walking next day with a very, very good result. And 95% of my patients, especially of decompression, get discharged the next day. They are fit to go home next day. They are confident enough. In fact, when I go for my morning rounds, it's a very usual practice that by the time I would want him to walk, he told me, he will tell me that, Doc, I walked in the evening to check myself and I'm already feeling very, very good. I was just waiting for you to come and see me and say bye-bye. I'm ready to go home. So that's very humbling. And because of the technology and because of the treatment strategies we have, my patients start walking next day. So if you are having a spine surgery, don't worry. There's a high possibility that you'll start walking immediately next day after the surgery, and the chances of rehabilitation and the kind of rehabilitation protocol we have is mind-blowingly amazing with very, very good results. So don't worry if you have these kind of problems. Meet your doctor, discuss it with him, and I'm sure him or her is going to tell you the right thing which needs to be done. If you have any queries, you can send us the WhatsApp or email text, and we would be replying to you as the time permits. Thank you very much. And if you think you like our channel, if you think we are able to deliver some good content to you, it's always a great thing to hit that subscribe button. Thank you very much.